Healthcare Systems by Whitney Arnold, RN BSN Program, McNeese State University, Nursing 302, Business and Healthcare, Dr. Patricia Morrell. The United States has a unique healthcare system. It is comprised of a quad function model: financial, insurance, delivery, and payment. Citizens must navigate this system to have financing provided by employers, the government, or self, oftentimes through insurance companies, to pay for services by providers. Individuals who are unemployed, disabled, or retired may not have access to private insurances and can qualify for Medicaid or Medicare. Insurance companies are then charged for services accrued from doctor visits, medications, equipment, housing, and other services. It is important, however, to understand that cost, access, and the quality of care are not the same for all citizens. Consistent with the World Health Organization, we define health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Indeed, for as long as the United States has been a country, the distribution of good health has been unequal. Equity can be defined as being impartial. Therefore, equity in healthcare should be impartial. However, as mentioned by Thurston, the distribution of good health in the United States has been unequal. Why is this so? We must evaluate the providers of healthcare, the setting where care is provided, and the purchasers of these services. Providers of healthcare can range from physicians, dentists, pharmacists, psychologists, nurses, advanced practice practitioners, and other allied health professionals. These providers care for an array of elements from preventative care to specialized care, involving different systems of the body and their diagnosis. Dentists diagnose and treat dental problems related to the teeth, gums, and tissues of the mouth, such as an orthodontist, a pediatric dentistry, or an oral pathologist. Pharmacists dispense medications prescribed by physicians, dentists, and podiatrists. They also educate on the use of medications. They can be pharmacotherapists, nutrition support, or radiopharmacists or nuclear pharmacists. Psychologists provide mental health care. They can work in areas with counseling, personal, or school. Nurses are the major caregivers for the sick and injured patients, addressing their physical, mental, and emotional needs. Nurses can be found in an array of specialties and fields. Advanced practice nurses can also work independently and as mid-level providers, such as a clinical nurse specialist, a certified registered nurse anesthetist, a nurse practitioner, or a certified nurse midwife. Other allied health practitioners can include physician assistants, physical therapists, registered dietitians, respiratory therapists, and more. Physicians play an important role in a patient's healthcare management by evaluating conditions, diagnosing abnormalities, and prescribing treatments. Physicians can become generalists or primary care providers and do preventative services and treat frequently occurring non-urgent problems. They can also become specialists and do subspecialties of internal medicine, a broad group of medical specialties, obstetrics and gynecology, or surgery. Nonetheless, there is a large maldistribution of providers based on specialty and location. Physicians are accumulating in metropolitan areas and large hospital networks. Lesser populated areas and rural towns have less access to providers and must travel long distances if possible to receive care. Physicians are also pursuing more careers in specialties rather than roles of primary care provider. This is causing larger patient volumes for basic care. Neither shortages nor surpluses are desirable. They result in an increase in healthcare expenditures without a positive return in health outcomes. While Shi and Singh mention more statistical data to represent that of physicians, the same maldistribution applies to all healthcare fields and professions. A setting in healthcare is a location a person is receiving treatment or medical advice. It can be completed in outpatient care settings or inpatient care settings, including long-term or assisted care facilities. Outpatient settings or ambulatory care are used to treat patients who do not require inpatient and consistent care. This can involve a physician's office, a specialty service, and even a digital environment. Inpatient settings, which require an overnight stay by the patient, may follow services after surgery, awaiting or giving birth, observation, or intensive care. Long-term care facilities like those for assisted living, rehab centers, or psychiatric care will also be considered inpatient settings. Services have expanded in outpatient care settings, providing more opportunities for individuals without coverage. The development of new diagnostic and treatment procedures and less invasive surgical methods have made it possible to provide services in outpatient settings that were previously required hospital stays. This may not always be with the best intentions in mind. Inpatient stays are forced to remain as low as possible to reduce reimbursement amounts. To make a profit, the hospital must keep its costs below the fixed reimbursement amount, which creates an incentive to minimize the patient's length of stay. Specialized insurance types are required for long-term care patients, as their state is often dictated by their diagnosis. Long-term care hospitals serve patients who need post-acute care but have complex medical needs and may have multiple chronic problems requiring long-term hospitalization. Long-term care hospitals must meet Medicare's conditions of participation. Services are now expanding into the digital environment. Some patients believe that in video consultation, patients have unrealistic expectations and get disappointed when they do not receive care. Even though it is possible to provide care for several problems digitally, there are still some limitations which make it impossible to help all patients. Purchasers can include individuals, companies, or government funding that pays for services to providers. This can include out-of-pocket costs for uninsured individuals, private insurance, Medicaid, or Medicare. Most private insurances are available through an employer or done independently and are required to pay a monthly or yearly fee to cover costs accrued from healthcare services. Other individuals who cannot afford private insurance may rely on coverage from the government based on age, ability, and economic status. Individuals who are willing to cover the costs or have private insurance typically do not struggle with healthcare services. However, depending on the provider, may be charged for more services. A second systematic review of the impact of payment methods on the behavior of primary care physicians found that those who pay on fee-for-service basis provided more services than those based by salary or capitalization. Individuals with Medicaid and Medicare have limited options of providers, locations, and services. Although the United States has some of the best medical practices and providers, the same access, cost, and quality of care are not provided or available for every citizen. Healthcare equity will be a difficult feat with the current system, unlike other developed nations who have access for all citizens. Providers must be willing to see diverse populations of patients and provide services in less urbanized areas. The United States may never go to universal health care coverage, but it remains a duty of all parts involved to help alleviate the health inequities.